Hi, everyone. Welcome to the Reframing Eye Care podcast. In today's episodes, we're diving in to the topic of presbyopia treatments, particularly miotics, with a special focus on patient experiences with satisfaction. We'll be exploring the optometrists, what optometrists should look for when they look for treatments, ideal candidates for miotics, how new therapeutics can shape the future of eye care. Plus, we'll discuss potential aceclidine and the possible impact on presbyopia management once it receives FDA approval. Dr. Shen Lee is a private practice co-owner, principal investigator, medical director for clinical research, and she's a fellow of the American, UK, European Academies of Optometry. Wow. And lectures internationally on topics for dry eye and ocular disease and healthcare, social media. So welcome to the podcast. It's such an honor to have you.
Thank you, Dr. Sampalis. Thank you so much for having me. This is a very exciting topic, especially with option number 2 about to hit the market and a miotic option number 3 looking forward to in 2025. It's a very exciting time in the field of presbyopia. Yeah.
It's very exciting for optometry as a whole, too, as we get new technologies. So give us some information. Where are you based? Share a little bit about your practice, how long you've been in this field for.
Sure. So for those of you who don't know me, my name is Bridgitte Shen Lee or Bridgitte Shen Lee. I am based in Houston, Texas. My private practice, Vision Optique, is 25 years old. It is a high-end optical, high-tech primary care, advanced contact lens practice, and we have 3 subspecialties: ocular surface and dry eye disease, myopia management, and also scleral specialty contact lens. In addition, we're also a clinical research site.
Yeah, you do everything. You're a woman that
we try. It's about teamwork. We have an awesome team of 4 doctors and more than 10 staff, and we're about to move into a new location. So it's a very exciting time for us as well.
Good. Congratulations on your success.
Thank you.
It's great to see that. Can you explain your experience with presbyopia treatments, including myopics, and how you utilize it in your practice?
Of course. So we have been prescribing miotic products since 2021, and the patients really appreciate having an eye drop option in addition to the traditional glasses, contact lens, and a refractive surgery. And
excellent. Can you explain your experience with talking to patients about their satisfaction and how they experience with the miotics that they had for the first round?
Okay, so what we have learned, right, when it first came out, we were all excited. It's like a new candy that we get to play with. So what we've learned very quickly, the key is to identify the right patients. So especially those patients who are interested. So what we did back in 2021, because at the time, there was another exciting anti-aging eye drop that came onto the market a little bit prior to the presbyopia eye drop. So we added this specific question to all the patient intake history forms. So we asked our patients, would you be interested to learn more about 3 anti-aging eye drops? That catches people's attention. Like, wait, anti-aging eye drops, what are you talking about? And then the staff lists down, 1 is to reduce the need for readers, 2 is to reduce the droopy eyelids and the lower lid eye bags, and 3 is to reduce red eyes. So when you present it in that format, it catches people's interest. And also, it's very helpful to identify those patients who are interested. So the staff will type in the EMR, yes, and then we'll say which one. And then at the end of the exam, or sometimes patients before, like when I walk in before I even start, they say, hey, doc, I hear this the eye drop that does this and this and this. Am I a candidate? Before I even have a chance to go over the testing result with them. So that makes it a very natural conversation when we review glasses and contact lens option at the end of the exam. So for those patients who are interested and patients who are good candidates, the result has been very positive.
Yeah, that's great. So when you're talking with them, what are some characteristics are you identifying with performance of these miotics with the patients?
Okay, so for me as a doctor, and I think for us as doctors, these 3 things are very important to me: efficacy, safety, and also impact on the distance vision because it is miotic. It does constrict the pupil size. So for efficacy, I would like to know, and I think it's important for us to ask, one, does it work? And how fast does it work? And how long does the effect last? And number two, on safety, is it safe to use long term? Is it safe to use a month straight? Is it safe to use 6 months? Is it safe to use year round? And number three, has this drop achieved this ideal pupil size, and how long does that effect last?
Yeah, I think ideal pupil size is very important for success.
Oh yeah, absolutely.
Yeah. So what type of presbyopic patients are good candidates for miotics? I know you touched on it a little bit, but as us doctors who are new to this, going to present this to our patients so we have success right away, so we're not nervous with something new category, right?
Well, let's start with the easy ones, right? So the easy ones are I think Lens came out with a new term, the med spa patients. I call them the patients who are interested in youthful anti-aging solutions about their physical well-being, right? So those are easy ones, people who are naturally interested in the anti-aging solutions, patients who are contact lens wearers, especially patients who are multifocal contact lens wearers, and your post-refractive surgery patients, because your post-refractive surgery patients is a self-selected subset of patients who didn't want to wear glasses and contact lens to begin with. So those are your three easy categories: the med spa patients, contact lens wearers, post-refractive surgery patients. So from our experience in the last 4 years, almost 4 years now, we also found 3 additional types of patients who are great candidates. Number one, your young presbyopes. It doesn't matter what your prescriptions are. So these are the people in their early 40s to late 40s. These, just have that conversation with them. Trust me, they're all annoyed with the fact that their up-close vision has changed. And the number two, emmetropes. The best patients are the emmetropes. So these are the patients who had perfect vision their whole life, Maria. They absolutely hate being presbyopic, and they are willing to have a extended discussion with you on all of their choices, and they love having choices. And the fact that if their only option is readers, that fact really, really annoys them. So, and the third category are your active patients. So these are the patients who are all presbyopic. They have a very active lifestyle, whether it's indoor and outdoors. When they're physically active, having the choice of not just depending on glasses and contact lens or refractive surgery, it makes them really happy.
Yeah, no, I think it's super exciting to have these new options, but I think some doctors might feel like it might take away from the optical, and I think that's a discussion to be had. But what do you think it means for practicing the future of optometry with these presbyopia drops? Because I think of this as an additive to my toolbox,
Yep.
but also get more patients into the exam room.
I totally agree with you. And I think having 3 additional in the course of next year, plus the one that we already have, right? So having 3 additional prescription eye drop option to treat the presbyopia is great for our profession as a whole, because patients like having choices, especially when it comes to their visual freedom. It is our job to educate them on what the choices are, and it's up to the patient to decide what they would like to do. So now we can offer all of, I think the latest number is, do you know how many presbyopes we have in this country, by the way?
Is it 85 million? I have no idea.
A lot more than that. Add another 45 millions to it.
There we go.
I had to Google it. So, okay. So in not North America, this is not Canada. In United States alone, there's currently 128 million, Maria, 128 million presbyopes. So now I think it's up to us to offer them 4 choices, right? 3 presbyopia eye drops, traditional glasses, traditional contact lens, or traditional meaning multifocal contact lens, and a refractive surgery. So I think for optometrists in both the corporate and the private practice setting, it's really important for us to embrace the new technology, just like we get excited over some major improvement in glasses lenses or multifocal contact lens technology.
Yeah, no, I think that's well said. And I think every practice can embrace this. This is easy to incorporate it into any practice, retain patients, get new patients, word of mouth. Because patients are going to find out this information. They don't need it from you to find out, right?
Correct.
They're going to see it online. They're going to hear about it from others. And you want to be at the front line to provide that information and give that. So I think that's important. Again, the concern would be like that it'll cannibalize glasses and other things. But I see it as an opportunity to get those, patients that were just doing over-the-counter readers, never had an eye exam, to come in. And I think of it also as, again, an additive, where we thought LASIK was going to hurt optometry. We thought contacts, when it first came out, was going to hurt glasses. But it's just an additive to the practice. What is your thoughts on it? Because you do a lot of different aspects of optometry.
Well, I like to share when I teach, right? Happy patients, happy practices. And that's a perfect example in this situation. So I completely understand the concern from some optometrists thinking, oh my gosh, if I offer this option, it's going to take away from my optical sales, especially for those optometrists who own an optical as part of their business, or those, I guess in the world of corporate optometry, those leaseholders, right? Because they're thinking, oh, well, if I offer this, then it's going to affect the glasses sales. So I think the concern is genuine, it's real. However, based on our own experience, I don't think they need to worry, because these same patients still need to have traditional glasses or contact lens when the miotic effect wears off. Because this is an eye drop that the patient, if they choose to, they need to put them in the morning, and as the day goes on, the effect wears off. So by the time, let's say they put it on 7 in the morning, get ready to go to work, by about 5 o'clock, the effect is wearing off. But life doesn't, Maria, you and I know that our real life starts at 5 p.m. We don't get a break until like 10 p.m., 11 p.m. So what do those patients do? So they still need traditional glasses and contact lens. But if you take the time to educate the patients on this new option or this choice, then they will actually, I think it helps improve patients' loyalty. Just like what you said, Maria, when the patients are happy and loyal and they appreciate the fact that you take the time to educate them, it just makes them much more likely to come back to you and refer their friends and family back into your chair.
Yeah, I agree. There's been some discussion that current therapies are not viable or satisfactory for some patients. Can you give us a little bit of insight on that, and how would doctors, tackle that?
Are you talking about not viable, not satisfied with the traditional means, like glasses,
That's
contact
correct.
lens, refractive
Yeah.
surgery? Okay, yeah. So I think it is challenging because there's so much noise out there, right? We're no longer the only providers of quality lens solutions, whether it's glasses lenses or contact lenses. There are a lot of other players in the market. So I think it's more important than ever that we become very effective communicators and educators. We have to be able to communicate to the patients on why the product that we prescribe would help them achieve their visual needs, and why they have to consider. And we have to be able to distinguish, right, the product that we sell at our optical stores, whether it's a chain or a private setting, versus something you can get for $19 online. We got to be able to explain the difference between the performance and the protection in what we prescribe versus what people can just purchase online. So I think the key is education and the communication.
Great. I think you talked about different miotics that we have, and a new one coming out soon in 2025. What would you say that aceclidine is unique, and what is unique about it?
Okay, so I'm really excited for the upcoming FDA approval of the new aceclidine. Aceclidine is a different molecule than the two current pilocarpine eye drops because it is a selective miotic constrictor. So by being selective, it has a much lower likelihood of negative impact on the ciliary muscle pull or the ciliary muscle stimulation. For the patients that we prescribe the miotics to, it's important that we have a baseline retina photos and to identify those patients who are at a risk of a retinal pull or retinal tear. Those are not the right type of patients for miotics. So with the aceclidine, because it's a selective miotic selective pupil constrictor, that's the right terminology. So the risk profile is lower and the mechanism is different, but the end result is the same because we all want the consistent small pupil for the improved depth of field. And that's how we get the consistent near vision. So yeah. Can I share with you about the data of the 3 clarity
if you
trials?
got data information, I think that's great.
Yeah.
I think listeners want that.
Okay, this won't be a long, boring data. Okay, this is just like a summary of my 3 favorite things about the data. So I was not a PI. I really wanted to, but I was not a PI for these studies. However, I did spend quite a bit of time studying the data because data is very important, especially when we embrace a new technology, when we want to start prescribing to our patients. So the key takeaway from the data are 3 things. Number 1, very fast onset with good and consistent clinical results. So 71% of the participants received more than 3 lines of near visual acuity improvement. Maria, guessing how fast that onset was? 3 lines near vision improvement, 71%. Guess how fast that onset is?
Minutes.
30 minutes.
That's minutes. Yeah.
30 minutes. Fast. Yeah. It's very fast. In 1 hour after patients put the drops in, 95% of them received more than 2 lines of visual acuity improvement. So the 3 lines better improvement stayed pretty consistent for all the way to about, I think, 3-4 hours. And then they measured all the way to 10 hours. So 10 hours after patient put the first drops in, 40% of them all have still have this more than 3 lines visual acuity improvement. And for both Clarity 1 and 2 studies, they have they measured all the way out 28 days. So they have very similar result 28 days out. So number 1, fast onset with a good and consistent result. Number 2, a safety study was conducted. So unlike the previous molecules, they actually did a Clarity 3, which is a 6-month safety data, and more than 95% of the reported adverse event were all mild. So it has a very good safety profile. And number 3, this is really important because what do? We restore people's vision and protect eye health, right? So number 3, the data showed statistically significant improvement in distance vision in the normal light. And there is no impact in the distance vision in the low light. So the data is pretty amazing.
Yeah, the data's amazing. I mean, I'm excited to have something like this in 2025. I mean, how do you envision patients benefiting from this product?
I think patients will be very excited to have this option. I know the doctors would be too.
Yeah. No, I think it's going to be exciting. I think it's a great time for optometry, for miotics, for a new category, a lot of new things that we can incorporate into our practice. And I'm sure new things will come out in the next few years too on this. I think once this comes out, I think it's going to make a big splash in the industry. I think a lot of patients are going to want it. I think a lot of doctors are going to want to incorporate it into their practice and find an option to, use it to gain more patients, maybe create more revenue for their practice. So it is exciting time for that category of presbyopia treatments that we can also get new patients in for the maybe get up more patients with the 128 million presbyopic patients we have.
Exactly. So imagine just getting 10% of these patients into the exam chairs, exam rooms, right? All around the country. Yeah. So I think great new technology, happy patients, happy doctors. It's a win. I think it's win-win for the profession.
It is a good information. But thank you so much for coming on the podcast. Thank you for what you do for optometry. Again, thank you for...
Same to you, Maria. You're doing a fantastic job leading corporate optometry. And I want to thank you for inviting me, coming on, talking about getting all nerdy and talk about data for new presbyopia treatment options.